Hello, my name is Dr. Alan Kerry. I'm a GP trainer in the Southend GP Vocational Training Scheme, and in this podcast I'll discuss the NICE guidelines for schizophrenia with Dr. Sunil Gupta, who's also a GP trainer. For further information, please look at National Institute for Health and Clinical Excellence website, which is at www.nice.org.uk. So Sunil, can you tell us a bit about what these guidelines say about schizophrenia and what is the scope of these guidelines?
NICE says that schizophrenia is a major psychiatric disorder or cluster of disorders characterised by psychotic symptoms. About 1% of the population will develop schizophrenia. The first symptoms tend to start in young adulthood. A diagnosis of schizophrenia is associated with stigma, fear and limited public understanding. There is a higher risk of suicide. There's been recent emphasis on early detection and intervention services. After an acute episode, there are often problems such as social exclusion, fewer opportunities to return to work or study, and problems forming new relationships. Most people recover, although some have persistent difficulties or remain vulnerable to further episodes. Carers, relatives and friends are important during assessment and delivery of effective treatments. The scope of these guidelines are the treatment and management of schizophrenia and related disorders in adults with an established diagnosis with onset before the age of 60. These guidelines do not address the specific treatment of people under 18 except those receiving treatment and support from early intervention services.
What does NICE say about access and engagement?
NICE says a number of things. Healthcare professionals should ensure competence in working with people from diverse ethnic and cultural backgrounds, and that's where things like assessment skills and using explanatory models of illness come in. And healthcare professionals should ensure competence in addressing cultural and ethnic differences in things like in treatment expectations and adherence, in beliefs regarding biological, social and family influences on the causes of abnormal mental states. Healthcare professionals should also ensure competence in explaining the causes of schizophrenia and treatment options, in negotiating skills for working with families of people with schizophrenia, in conflict management and conflict resolution. Other things NICE says is mental health services should work in partnership with local stakeholders, including those representing BME groups, to enable access to local employment and educational opportunities, and work with agencies such as Job Centre Plus. Disability employment advisors and non-statutory providers should be sensitive to the person's needs and skill level. And the other thing NICE says is identify a lead healthcare professional to monitor and review access to and engagement with psychological interventions, decisions to offer psychological interventions, and equality of access across different ethnic groups.
So what's the role of primary care in the monitoring and monitoring the physical health of people with schizophrenia?
GPs and other primary healthcare professionals should monitor physical health at least once a year, focus on cardiovascular disease risk monitoring. People with schizophrenia are at higher risk of cardiovascular disease than the general population, and NICE advises a copy of the results should be sent to the care coordinator and or psychiatrist and be put in the secondary care notes.
What do these guidelines say about psychological interventions?
NICE advises offering cognitive behavioural therapy to all people with schizophrenia, offer family intervention to all families who live with or are in close contact with the service user. Both can be started either during the acute phase or later, including in inpatient settings.
What does NICE advise about pharmacological interventions?
For people with newly diagnosed schizophrenia, offer oral antipsychotic medication, provide information and discuss the benefits and side effects profile of each drug offered with the service user. The choice of particular antipsychotic drug should be made by the service user and healthcare professional together, considering the relative potential to cause extrapyramidal, metabolic and other side effects, and the views of the carer if the service user agrees. NICE says that do not initiate regular combined antipsychotic medication except for short periods, for example when changing medication.
What do these guidelines say about interventions for people with schizophrenia whose illness doesn't respond adequately to treatment?
NICE advises review the diagnosis, check adherence to antipsychotic medication and the dose and duration, review engagement with and use of psychological treatments. If family intervention undertaken suggests cognitive behavioural therapy, if cognitive behavioural therapy undertaken suggests family intervention for people in close contact with their relatives, consider other causes of non-response. Offer clozapine to people with schizophrenia whose illness has not responded adequately to treatment despite the sequential use of adequate doses of at least 2 different antipsychotic drugs. At least one of the drugs should be a non-clozapine second-generation antipsychotic.
What's the role of arts therapy?
Consider offering arts therapy to all people with schizophrenia, particularly for the alleviation of negative symptoms. This can be started either during the acute phase or later, including in inpatient settings.
Thank you. Both Sunil and I would like to emphasise again the importance of looking at the NICE website for the latest advice, and we'd like to thank you for listening to this podcast.